you tell me about why you conducted this project?
Absolutely. Total knee arthroplasty, or TKA, is generally considered to be an effective intervention to improve pain and function among patients with arthritis of the knee. With the aging population and mounting obesity epidemic, rates of knee arthritis have increased really dramatically over the past 2 decades, such that TKA surgery now constitutes one of the most common and costly medical procedures in the US and Canada. Many studies that have used survivorship and surgeon-based outcome measures have generally indicated high success rates of TKA surgery that generally exceed 80%. On the other hand, when we use patient-based outcome measures, that tells a different story, where up to 30% of patients continue to experience pain in the months and years following surgery, and that constitutes a major public health burden. So, pain catastrophizing is a psychological response style to pain that reflects anxious preoccupation with pain, the inability to inhibit pain-related fears, an amplified interpretation as to the significance of pain with respect to its health implications, and a general sense of helplessness with respect to pain. Now, in recent years, there's been research that's shown that pain catastrophizing can be an important predictor of untoward surgical outcomes. So to clarify its impact in TKA surgery, we aim to systematically review the literature to date on pain catastrophizing as a prospective predictor of chronic pain following TKA surgery.
How did you complete the review?
We searched Medline, Embase, and PsycInfo databases to identify articles related to the constructs of pain catastrophizing, TKA surgery, risk modeling, and chronic pain outcomes. 2 authors independently reviewed our titles, abstracts, and full-text articles to identify original research studies that met our inclusion criteria, which were a pain catastrophizing exposure, a TKA patient population, chronic pain outcome, which was assessed a minimum of 3 months post-operatively, prospective longitudinal study design, an original research paper, and written in English. Any discrepancies in our study selection were resolved via consensus, and we additionally engaged in methodological quality assessment for all studies that were included. Due to the considerable heterogeneity in follow-up, analyses, and outcomes reported, a quantitative meta-analysis cannot be performed.
What were your main findings?
Overall, we identified 6 research studies that had small to mid-sized samples that met our inclusion criteria. So in spite of the considerable heterogeneity in the outcomes reported, pain catastrophizing was found to be a significant predictor of chronic pain in 5 of the 6 studies that we found. We observed a number of limitations, however, in our included studies, such as a lack of large-scale or population-based data, failure to adopt standardized outcome measures for pain that would allow direct comparisons between the studies, and inadequate multivariate adjustment, as well as failure to report the non-significant parameter estimates.
What were some of the clinical implications of this project?
Great question. Well, in this review, we found a moderate level of evidence that pain catastrophizing may constitute an independent risk factor for chronic pain following TKA surgery, although future research is definitely warranted to confirm this association. Importantly, the lack of uniformity in data capture, particularly with respect to pain outcomes measured, precluded the potential for meta-analysis, which really underscores the need for future researchers to employ standardized outcome measures for chronic pain. Additional directions for future research would include larger, well-controlled studies that allow for multivariate adjustment for potentially important confounders, including analgesic use, depression, and anxiety. Further, it would be valuable to identify clinically relevant cutoffs for pain catastrophizing scores that predict pain outcomes, and finally, to evaluate interventions that target pain catastrophizing to assess their impact on chronic pain outcomes following surgery.
Thank you for sharing that.